The United States Congress has designated January as Cervical Health Awareness Month. During January, the National Cervical Cancer Coalition and its many chapters across the country highlight issues related to cervical cancer, the importance of early detection, and the human papillomavirus, or HPV. HPV is a very common infection, and it's a major cause of cervical cancer. According to the CDC, about 79 million Americans are currently infected with HPV. About 14 million people become newly infected each year. HPV is so common that most sexually active men and women will get at least one type of HPV at some point in their lives. January is a time to raise awareness on how women can protect themselves from HPV and cervical cancer. We stopped by Baylor's Gone White Clinic in Cedar Park to talk to pediatrician Dr. Goddy Corpuz on ways to protect yourself from the virus. HPVs are a group of more than 200 related viruses. According to cancer.gov, more than 40 HPV types can be easily spread through direct sexual contact, from the skin and mucous membranes of infected people to the skin and mucous membranes of their partners. HPV infections are the most common sexually transmitted infections in the United States. About 14 million new genital HPV infections occur each year, according to cancer.gov. There are 3 FDA-approved HPV vaccines, which are Gardasil, Gardasil 9, and Cervarix. Gardasil is the HPV vaccine that helps protect against 4 strains of HPV. December of 2014, the FDA approved Gardasil 9, which covers 9 strains of the virus. HPV vaccines are highly effective in preventing infection with the types of HPV they target when given before initial exposure to the virus, which means before individuals begin to engage in sexual activity.
And the earlier you get it, the better. And as a pediatrician, HPV vaccines approved for 9 years old and up. Most pediatricians will give it around 11 to 12 years of age. So all the data is showing if you give it before age 15 years, you get the most protection out of it.
According to cancer.gov, the combination of HPV vaccinations and cervical screening can provide the greatest protection against cervical cancer. So how many shots are in the vaccine series?
It's a 3-shot series. You do it in a span of 6 to 12 months. So if we get 1 HPV shot now, you can get the booster one in 1 to 2 months. And then the third one you can give as early as 6 months.
Many people think the HPV vaccine is only for girls, but this vaccine protects boys from certain HPV-related cancers too. The vaccine is recommended for boys at 11 or 12 years. The CDC says that every year, over 9,000 males are affected by cancers caused by HPV infections that don't go away. Cases of mouth-throat cancers are on the rise. The CDC states that if current trends continue, the annual number of cancers of the mouth and throat attributed to HPV is expected to surpass the annual number of cervical cancers by 2020. It's important to remember that the HPV vaccine does not treat the infection. They provide maximum benefit if a person receives them before he or she is sexually active. So it's important to get the vaccines as early as possible. If a woman has been vaccinated, it's also very important to get screened for cervical cancer. Because the HPV vaccine does not protect against all strains that can cause cancer, screening continues to be essential to detect precancerous changes in cervical cells before they develop into cancer. So ladies, make sure to continue getting your annual pap smear. And men, ask your doctor about the HPV vaccine and if it's right for you. For RxWiki, I'm Shelby Collinen.